Good morning. My name is Jaco Festekjian. I'm a professor in plastic surgery at UCLA. I've been there about 15 years. And I do practice in both reconstructive and cosmetic surgery, mostly concentrating on breast and body. Today I want to talk about a sort of a very popular topic and it's called the postpartum makeover. And as exciting as having a family is, sometimes the pregnancy and breastfeeding can cause some sort of untoward effects on the body of a young woman. And I'd like to introduce you some procedures that we do offer at UCLA to help sort of address those asymmetries or address those undesired effects on the body. And then we're going to go right into it and start out with the first one. And that's a tummy tuck, the most popular operation performed after having sort of 2 or 3 kids. The abdominal wall gets stretched, the skin gets stretched, and women have stretch marks in the lower part of the abdomen. And also the muscles that are in the middle of the abdominal wall separate. So essentially a woman is not able to perform a sit-up after a pregnancy. And a tummy tuck addresses all those things I just mentioned. So the rectus muscle is what I'm talking about as far as separation in the midline. And we bring it back to the middle, and that usually decreases waist size, which is a very, very popular thing where it's a very nice effect that you have, that you decrease your waist size after pregnancy. Remove stretch marks from the lower part of the abdomen, mostly below the belly button. There's a common myth that the belly button is moved. Actually, we don't move the belly button, nor do we alter it. We leave it in the same location, except we rejuvenate it a little bit. And it requires a 2 to 3 hour procedure under general anesthesia with an overnight stay. The only downside to it is there is a drainage tube that the young lady goes home with for about 7 to 10 days, and we take it out in the office. Usually driving can happen in about 2 weeks, and usually I allow people to exercise in about 6 weeks. And one thing that women will notice is they'll be able to do a sit-up, which they couldn't do before. And it actually, a lot of women, postpartum women, complain about bloating when they eat. That also is resolved by the tummy tuck. And then I usually don't allow weightlifting more than 15 pounds for about 6 weeks. Some of the sort of results that we before and after photographs. And it shows a loss of tone of the abdominal wall from the pregnancy. Basically, the size of the baby has stretched the abdominal wall muscles, and when we bring back to it's a dramatic difference. And you can see the scar right there in the lower abdomen, and it brings back the muscle back to the midline, and it takes away all the stretch marks or like excess skin. Sorry. This is another example of loss of tone, and we've actually basically brought back tone to the abdominal wall. This is a front view. Sometimes there's excessive skin and fat in the lower abdomen, and all that is pretty much removed entirely. And the belly button is the same as her belly button, except it's rejuvenated. It looks healthier. It looks like it's more young looking, so to speak. And this is another example of a side view of getting tone back to the abdominal wall. C-section scars. A lot of women complain that their C-section scars, why do they look so ugly after having a C-section? Well, during birth, the only thing they're worried about is actually the baby and the health of the mom, and the C-section closure is the last thing on their mind. So it's closed in a hurry, and it's closed in one layer most of the time. So what we do is we recreate the incision, and we try to close it as best as we can. So we try to disperse the tension of the wound across the entire edge of the entire length of the wound, and we close it in 3 layers as opposed to 1 to 2 layers. And recovery is very minimal. It's an outpatient procedures. I don't even restrict patients to any activity restrictions whatsoever. Sometimes the location of the scar is too high in the abdominal wall. We can lower it, and depending on how high it is, and that can be done so that it can be covered by any underwear that the woman wears. And sometimes we combine it. We combine it with what's called a mini tummy tuck or a full abdominoplasty or a full tummy tuck. This is an example of a C-section scar that's not addressed. I wanted to show you a picture of what it looks like. So it looks like there's a shadow created by the scar, and there's a little bit of fold above it. So what we do is we fix that. We recreate the scar, get rid of this tiny fold, and produce a flat abdominal wall with the scar in the middle of it that over time fades and you hardly ever notice it. Liposuction is a very, very common procedure after pregnancy, and it's something that may not be caused by pregnancy but becomes evident more after pregnancy. And liposuction is not designed, I want to repeat that, it's not designed to help a woman lose weight. It's designed to address those little pockets of fat. No matter how much you exercise, how hard you diet, it doesn't go away. And it's very good for those areas. And it takes only a few days to recover. And sensory changes, what I mean by that is the liposuction causes some sort of weird changes in the skin sensation, and usually feels like things, women describe it as things crawling under their skin, that usually goes away. Again, it corrects localized deformities, corrects asymmetries between right and left. And however, you cannot do liposuction on someone who has a lot of excess skin. You actually make that excess skin worse by taking the fat away. So sometimes we combine liposuction with tummy tuck, for example. Sometimes we do a mini tummy tuck and liposuction. So it's very logical to actually combine procedures depending what the problem is. Usually I ask patients to wear a compression garment. It's usually a girdle or a sort of a compression garment around the arms, wherever the liposuction areas are, for about 3 weeks. In the winter, I ask them to wear about 6 weeks, because the more compression you wear, the better the result. And then usually for very fair skin individuals, there's bruising about 2 to 3 weeks. Again, most are done as an outpatient procedures. Sometimes if there's a high volume of liposuction, we require patients to stay overnight for safety reasons. And 10% reoperate, this is very important. A lot of times, we do the liposuction. For example, if there are asymmetries between right and left, we try to make them symmetric in the operating room, but it's too much swelling. We get confused sometimes, and sometimes the leftover sort of a deposit remains. We address those later at no cost to the patient, obviously. The liposuction doesn't take long. It takes anywhere from 1 to 3 hours, depending on how much is being suctioned and how many body parts, so to speak. Usually they're back to work very quickly and exercise right away, depending on how much pain they're in. And I usually use very tiny scars to perform the liposuction. I usually hide the scars in a natural crease. These are some of the results from pre and post liposuction. These are outside thigh liposuction before and after. And it's a dramatic sort of improvement. This is from the view from behind. Again, the lateral thighs. And this is another example of outside thigh liposuction before and after. Next procedure we do offer is breast augmentation. So usually the implant is placed, whether it's silicone or saline, it's placed underneath the muscle so that detection of, or mammogram is not interfered with. Usually we place the incisions in the fold of the breast or at the edge of the areola. Fills the upper pole deficit. This is the most common side effect of pregnancy and or breastfeeding, where the breast loses the upper portion, it becomes flat, too flat at the top, and this is what breast augmentation addresses most efficiently. It's an outpatient procedure. It's done under general anesthesia. It's about a 2-hour surgery and 7 to 10 day recovery, and usually the women can go back to full physical activity at about 3 to 4 weeks. The two common types of implants now are saline and silicone. Are there any other types? Yes, there are. Other types are there, but non-FDA approved. Only silicone and saline are. There are some other material, for example, soy products are being introduced in the market slowly, but not quite FDA approved yet. There is no difference between the two in the way how long they live. They rupture at the same rate. The lifespan of an implant, whether it's silicone or saline, is the same. And the only thing, the difference about them is that the fact that they behave differently when they rupture. A saline implant, when it's ruptured, it goes flat because it's full of saline. Saline is a natural fluid that runs in our blood, so body just reabsorbs it. As opposed to silicone, when a silicone ruptures, the breast will start becoming firm, not over days or weeks, but over months and years. And one day a woman may realize that one breast is firmer than the other one. Then there is an assumption that the implant is ruptured, an MRI is performed, confirmed rupture, and we usually like to change them at that point. However, silicone, in my opinion, is superior with respect to how it feels and with respect to how it looks. It looks more natural, it looks more breast-like, as opposed to a saline implant, which feels more like a water balloon. These are some examples of before and after silicone implantation, and then there's a 6-month period between the two. And what I'm talking about is this right here, where pregnancy and or breastfeeding will shallow the top of the breast. And this is what an implant addresses most efficiently. And there's another example of, I showed this picture because it's immediately after surgery. And then again, it addresses the top pole really, really nicely. Again, before and after. And one last one. This is at the end of surgery in the recovery room. And my marking is still fresh. I just want to do several pictures, 6 months out, many years out, and then immediately after operation. This is about 2 years out, and then the result maintained themselves. It's a very, very sort of a long-lasting procedure. And again, this is post-pregnancy that did not breastfeed. However, there were some changes with pregnancy, but again, we addressed it. There's another patient. Again, the most common effect of pregnancy is losing the top pole of the breast. What about breast reduction? This is probably one of the only procedures that may be covered by insurance. It depends on the height of the patient. It depends on the weight of the patient. It depends how much I estimate that I will remove. Usually insurance companies require about 3/4 of a pound per breast tissue removal to be able to cover it by insurance. And they usually correlate that with the height and weight of the patient. So we reshape the breast, we give it a perk, so to speak. In the process of breast reduction, we actually make the breast perkier. And it gets rid of back pain, neck pain, posture is improved. Overall, it's a very, very successful operation in resolving neck and posture issues. And improves exercise tolerance. Most women lose a lot of weight after breast reduction because they get motivated. It takes me about 3 hours to perform the procedures. I stopped using drainage tubes in breast reduction patients. We don't need them. I usually ask them to wear a sports bra for 3 weeks. They're back at work at 2 weeks, and they usually start exercising in about 6 weeks. The one thing I have to mention about breast reduction is the fact that it adds significant scars to the breast. And they're the shape of a ship's anchor. They go around the areola, down to the fold and in the fold. In the 15-year practice I've been at UCLA, I'm yet to receive a complaint about how the scars look, because the overall benefit, the aesthetic benefit, and the back pain benefit from breast reduction is so good that people don't even talk about their scars. This is an example of before and after. This is only about 1 month after surgery, and a significant improvement in posture. The grooves of the shoulders disappear, the back pain disappears, the posture disappears, and the exercise tolerance increases. This is another example of an extreme case of breast reduction before and after. Mastopexy is basically the same operation as a reduction, where it produces perkiness of the breast without the loss of volume. Essentially, it's a breast lift. And scars are exactly the same as a breast reduction. It's a ship's anchor looking scar. And it's basically, it looks like that on a sort of an animated view. It reshapes the breast, lifts it, and in return, an anchor pattern scar is placed, and recovery is about 2 to 3 weeks as the breast reduction. This is an example of extreme sort of post-pregnancy weight loss that led to sort of drop of the breasts, and we lifted it for her. She's very happy with it. She didn't want to be augmented, she just wanted to be lifted. Another example of lift without loss of volume. I just wanted to give you a sort of a broad introduction to the kind of procedures that we can offer. And I want to thank you for listening in. I do understand that there are several questions that were asked, and I can happy to answer right now. what if, well, first question is, what if I'm done having kids, can I still have this procedure? Actually, we like you to have this procedure after you're done having kids, because having this procedure before having kids is, another pregnancy will actually ruin the result. So the ideal thing to do is be done with having kids and then address the problem at that point. So that's probably the most ideal time to perform it. Another question is silicone implant safe? It's extremely safe. It's been proven now over 50,000 women have had silicone implants since 2007. That's when the FDA approved silicone implant, to a point where I prefer silicone over saline because of its safety. Do areas of liposuction grow fat back? They don't grow from the area of the liposuction. The amount of fat cells that were removed from a certain body part do not come back. If a woman gains weight, the body disperses it in all other areas except that area. Are any of the procedures covered by insurance? As I addressed in the talk, usually breast reduction is probably the only one that will be covered by insurance, and it has to do with height and weight, and the size of the reduction that's what is relevant. But probably the only procedure out of the ones I listed that has a likelihood of getting covered by insurance. Again, thank you so much for listening in, and hope to do this again in the future, and hope to have some helpful tips if I can. And thank you again.